Hi, this is a demonstration of lightning charts. Today we're going to show you a chest pain, and what we're going to show you is highlights of what makes lightning charts different. First, we'll initiate the application by touching the icon on the iPad, log in using a HIPAA-compliant password, and what you'll see first is a list of all the patients in the department, color-coded by their status. We're going to pick a chart on Perry Quinton, and what you'll see is that the chart has been dynamically created based on a male of his age group for a chest pain complaint, and it's totally complete but inaccurate. We will now edit to accuracy. We'll be able to put in the pre-hospital medications from ambulance because we've loaded in the formulary for what your ambulances have on the rigs. We're now going to edit the history of the present illness, which has already been formatted to be appropriate for a level 5 exam. It's just not accurate. So we're going to edit the character of the pain, as you see now, then the timing of the pain at 30 minutes, and the radiation of the pain. It goes to the left arm, the jaw, and the neck. Sometimes you need to add core measures in. As you see here, comment allows you to make an aspirin comment to show that aspirin was given, as above in the ambulance, period. And to add text to the history of the present illness that allows it to be more readable and believable, we use drag and dictation. The patient's chest pain was exacerbated after a fight with his spouse. We then add that right to the history of present illness. Past medical history is easily modified by our choice point menus, which allow us to give the patient an appropriate past medical history. In this case, atrial fibrillation, benign prostatic hypertrophy, congestive heart failure, and diabetes mellitus type 2. These are also clonable forward on the next visit. A good example of dynamic charting is how we do social history. We're able to add other aspects of social history easily and on the fly, and without having to go to another template, period. These are also clonable forward on the next visit once they're approved, period. Scores are becoming increasingly important in evidence-based medicine. And as I show you here, any score in medicine can be added to lightning charts. In this case, it's a TIMI score. One of the things that we do better than almost anybody is procedures. All of medicine does procedures, particularly in the emergency department. In this case, I'm going to document the insertion of a central venous pressure line. Timeout was done. Consent was obtained. In this case, we're going to show procedural sedation as an example. So we add procedural sedation. We're going to add an ASA score. And we're going to change that ASA score to be somewhat compatible with his current standing of a chest pain patient. Ultrasonic guidance is added here. It was not a right internal jugular. We put a right subclavian in. I prefer chlorhexidrine over betadine. And I always ask for a chest x-ray post-procedure to make sure there's no pneumothorax, period. We're now going to use dynamic chart creation again to make this into a critical care chart. Where once critical care did not exist, it does now. And the bullet points that CMS requires for documentation, for payment, and for appropriateness are now available to the physician. These reminder lists still need to be picked by the physician to show that he did these, but it acts as a great checklist for medicine. Once again, the use of Dragon to give the proper flavor to what happened in the emergency department. The patient was offered admission but declined, period. After discussion with his private physician, he agreed to be admitted to the hospital, period. What you see now is a chart that reads like a dictated chart. It's complete. When we try to sign the chart, we have the ability to put hard stops in to make sure that not only core measures are met, but any other quality standards that the institution or doctor group wants to have performed. Once again, trying to sign a chart, it always takes you to the next one that needs to be filled out. In this case, re-examination over a period of 2 hours. And then it would take you to one more if we try to sign the chart again. But that is what makes lightning charts different. I hope you enjoyed the demo, and we look forward to hearing from you.